Welcome back to East Texas Live on KETK. Well, joining us in the living room now is Tom Holland from CHRISTUS Trinity Mother Francis.
And today he is here to tell us about Patient Access Week. Good morning.
Morning. How are y'all?
Good.
Doing well. So, what is Patient Access Week all about?
So Patient Access Week just recognizes the employees that help schedule and register patients that come into our system. We're a large system. We see thousands of patients a day. So, you need to have a logistical process to make sure that we're able to see patients efficiently and effectively.
And how important is it for them to get these people in as soon as possible?
It's very important. So, if your family practice doctor writes an order, say for an MRI, how do we schedule that MRI? We have to contact the patient, make sure it works with their schedule and our schedule, get them on the books. We have to contact the patient's insurance company, make sure that we can get an authorization if needed. We then have to make sure that the patient's aware of what their benefits cover with insurance. So there's a lot involved with patient access and multiple steps to it. So
that seems like a very intimidating process.
It can
be. You folks at CHRISTUS Trinity Mother Francis, y'all have a lot of staff working on this.
We do. We have about 400 employees in patient access.
Wow.
They cover anything from a scheduling team to a registration team, financial counseling, pre-registration, insurance verification. There's a whole lot of roles within this overarching department.
So really, how does the patient access staff impact the patients then?
So we will take a physician's order and we'll contact the patient. We'll make sure that we can get whatever they're ordering taken care of and scheduled. We like to try and contact the patient in advance to go ahead and do a pre-registration, make sure that they understand their benefits. If they're going to owe anything that their insurance is not going to cover, we cover that with them then. We try to be as transparent as possible just for the patient's benefit more than anything else.
Yeah.
When one walks into the hospital, hospital's already huge enough. At what point in the process does the patient interact with the staff?
We are the first person when you walk in the door. I call my department the face of the organization because we're literally the first face you see when you walk in the door and typically the last one you leave. So it's very important to be very warm, very welcoming. A lot of patients that come into the hospital are very nervous, and so we're kind of that calming factor for them. We're able to just kind of make them feel a little better about it. We're talking to the doctors. We know a lot of the doctors personally, so we're an important piece of the whole flow.
Well, I was going to say, because realistically there's a lot on your end to take care of, so how can you really reassure them that you are working as fast as you can?
Well, hopefully by the time the patient shows up to the actual hospital, we have everything done. So to the patient, it's very seamless. But there's a lot of work going on in the background to make sure all that's taken care of, to make sure we have that insurance authorization, make sure we have all the information we need from the doctor, from the patient, from everybody involved, just to make things go smoothly for the patient.
So essentially, your staff serves as a bridge between the patient and the care.
Absolutely, every time. Yeah.
And how does CHRISTUS Trinity Mother Francis, in what ways do you guys work to ensure, that emergency room wait times are lower than what, others might be compared to?
We have a very busy emergency room right now. We're trying to work to correct that, but when patients get back to an actual bed and we're able to take care of the registration, at that point my team gets involved and is verifying demographics, checking the insurance, talking with the patient about their insurance plan as far as how that's going to impact their emergency stay if that turns to an inpatient. So it's one of those things that we strive to be as transparent as possible from the insurance process and our process.
Okay, sounds good. Thank you so much, Tim.
Thank you.
Appreciate it.
Thank you very much.